Introduction. Sickle cell anemia was first discovered in 1910 in a dental student with pulmonary symptoms. Sickle cell anemia appears with symptoms such as episodes of pain, jaundice, and anemia. James B. Herrick coined the name sickle cell after observing the sickle and crescent shape of the blood cell. Sickle cell anemia, also known as SCA, poses its threat by being stiffer than a regular blood cell. This blocks blood movement in vessels and has a shorter lifespan than a regular blood cell. Statistics. Globally, about 7.74 million people have sickle cell anemia. About 515,000 new births with sickle cell anemia occur each year. About 100,000 people in the U.S. live with sickle cell anemia, and about 1,800 to 2,000 new births with sickle cell anemia occur each year nationally. 1 in every 365 Black or African American babies are born with sickle cell anemia. Sickle cell anemia is not sex-linked, so men and women have both equal chances.
Phenotype description and inheritance. Some symptoms and characteristics of sickle cell anemia include anemia, episodes of pain, swelling of the feet and hands, frequent infections, delayed growth, vision problems, and fertility problems. Sickle cell anemia is caused by a mutation in the HBB gene, which is located on chromosome 11 and is responsible for producing hemoglobin. The life expectancy of people with sickle cell anemia is 49.3 years for males and 55 years for females. And sickle cell anemia is an autosomal recessive disorder. It's caused by point mutation in the gene sequence. While some may not have the disease, humans can still be carriers for sickle cell anemia. Abnormal gene effects. Mutation in the HBB gene causes a change in beta-globin protein, resulting in blood cells being misshapen. This is a single point mutation where adenine is replaced with thymine in the gene's 6th codon. This change in the gene sequence causes the hemoglobin produced with the instructions from the HBB gene to be altered. And that altered hemoglobin produced is called hemoglobin S. Hemoglobin S is a lot more rigid and stiff than normal hemoglobin, and they're sickle-shaped, where normal blood cells are circular. So that stiffness combined with the unique shape of hemoglobin S causes blood cells to clot together more frequently, resulting in the pain and swelling that are the key characteristics of sickle cell anemia. Diagnosis and treatment. Blood tests can be run to examine the amount of hemoglobin in blood cells to determine if sickle cell anemia is present. Treatment of sickle cell anemia is primarily to decrease pain. There are 4 medicines approved by the FDA for treating sickle cell anemia: hydroxyurea, L-glutamine, crizanlizumab TMCA, and over-the-counter prescriptions. In severe cases, blood and bone marrow transplants, also known as hematopoietic stem cell transplants, can be used to cure patients. However, this procedure contains numerous risks and complications, including death. Listed is contact information for Sickle Cell Disease Association of America, Incorporated.
Implications of sickle cell anemia. Ethical and legal implications. Because the Black and African American race is more susceptible to sickle cell anemia, this may cause prejudice in healthcare and around sickle cell anemia itself. Who should know? If employers, courts, schools, adoption agencies, and military request medical records, it should be up to the person with sickle cell anemia to approve or deny and make their condition known. Does it affect reproductivity? 2 people with the carrier trait may be hesitant to reproduce because then they would have a near 50% chance of their offspring having sickle cell anemia. Sickle cell anemia does affect fertility during pregnancy. It increases their blood clotting risks before, during, and after reproduction. Sickle cell anemia also affects overall reproductive health in women. Because medication and a cure already exists for sickle cell anemia, genetic testing may not be required. But in severe cases where medication and blood and bone marrow transplants would not be efficient enough, the patient should have the choice to opt into genetic testing. Because sickle cell anemia is a single point mutation, reverting the one mutated nucleotide may resolve the problem.